Hi everyone. Today in this video we are going to discuss about ezetimibe. What is this drug ezetimibe? This is one of the drugs which reduce the cholesterol levels within the body by reducing its absorption. So ezetimibe is a cholesterol absorption inhibitor. This drug acts by unique mechanism, thereby it specifically inhibits the absorption of cholesterol, resulting in reduction of LDL cholesterol as well as decreased levels of ApoB enzyme, which increase the risk of atherosclerosis. Similarly, it can reduce non-HDL cholesterol and even it can reduce triglycerides. By all of these, the total cholesterol levels are also reduced by this ezetimibe. And interestingly, this drug can also increase the HDL cholesterol levels, which reduce the risk of atherosclerosis. So this drug ezetimibe can be used as a monotherapy, particularly in the treatment of primary hyperlipidemia, where there is increased levels of LDL cholesterol, ApoB, total cholesterol and non-HDL cholesterol. In such cases, ezetimibe can be used to control the cholesterol absorption, thereby can reduce the levels of LDL, non-HDL, ApoB and total cholesterol levels. But many of the times, ezetimibe is given in combination therapy along with statins, otherwise with fenofibrate. So it can be used in the familial homozygous hypercholesterolemia. In this condition, we can observe elevated levels of LDL in the type 2A, but in the type 2B, we can observe elevation of both LDL as well as VLDL. Since ezetimibe can control the levels of both LDL as well as triglycerides, it can be combined with both statins as well as fibrates in order to reduce type 2 hypercholesterolemia. And this drug can also be used in the conditions such as cytosterolemia, where there is increased levels of cytosterols, the plant sterols. Again, in such conditions, ezetimibe can be used. Now let us see how this drug acts. Ezetimibe mainly acts on the absorption of cholesterol. Specific transporters for the absorption of cholesterol are present at duodenum. So from the diet, what are the cholesterol that is present within the colon? Otherwise, the cholesterol which is recirculated by biliary secretion. This cholesterol may be present in the micellar form. So this can be absorbed through specific transporters. These are nothing but NPC1L1. Now through these transporters, cholesterol can be absorbed where it can be converted into free cholesterol. This free cholesterol is going to be esterized by one of the enzyme ACAT, acyl cholesterol acyltransferase 2 enzyme. So by this enzyme, now the cholesterol can be converted into cholesterol esters. Now these cholesterol esters can be transported into the lymphatic circulation as chylomicrons. Now these chylomicrons are rich in both triglycerides as well as cholesterol. The triglycerides are going to be absorbed by the muscle, where it is going to be converted into free fatty acids by lipoprotein lipase enzyme. Now, what are the remaining portion after the absorption of triglycerides is secreted into the systemic circulation as chylomicron remnant. Now, this chylomicron remnant, which is rich in the cholesterol, can be taken by hepatocytes, where this chylomicron remnant can release the cholesterol into the liver. In this way, cholesterol which is present in the diet is going to be absorbed and it is going to be stored into the liver. Now, ezetimibe is one of the drugs which can block these NPC1L1 transporters such that cholesterol is not absorbed. Instead, it is excreted through the feces. One of the important points is that here ezetimibe is blocking the transport of cholesterol specifically. Therefore, it is not interfering with the absorption of other lipophilic compounds such as vitamin A, D, E, K, as well as lipophilic drugs such as digoxin. All their absorption is not affected by this ezetimibe. On the other hand, bile acid binding resins can reduce the absorption of lipophilic drugs and vitamins, but ezetimibe is free of such drug interactions. Now, the chylomicron remnants can enter into the hepatocytes, where they can be converted into free cholesterol, such that cholesterol can be stored into the liver. Now, ezetimibe is one of the drugs which is going to block the absorption of cholesterol, so it can reduce the transport of chylomicron remnants so that the cholesterol storage within the liver is going to be reduced. Now, in order to increase the stores of cholesterol within the liver, hepatocytes can express LDL receptors. Now LDL cholesterol which is present in the blood can bind to these LDL receptors. Then it is going to be internalized by lysosome. Now the lysosome can digest this LDL cholesterol and it can release as free cholesterol. In this way, by the action of ezetimibe, LDL cholesterol within the blood is going to be reduced due to increased expression of LDL receptors. This is just like the mechanism of statins, but here ezetimibe is reducing the cholesterol levels within the liver by reducing the absorption within the small intestine. That's why ezetimibe can be combined with the statins in order to produce effective reduction of LDL cholesterol. Now let us see the precautions of ezetimibe. One of the important precautions of ezetimibe is just like the statins, it can affect the liver functionality such that liver enzymes can be elevated. So the alanine transaminase levels, ALT levels, as well as aspartate transaminase levels can be elevated by this ezetimibe. And when these liver enzymes are elevated by 3 times of their upper normal limit, then this drug should be stopped. Otherwise, this drug should not be used in combination with the statins in order to reduce further liver dysfunction in the patients. Similarly, ezetimibe can affect the muscle and it can produce some myopathy, but practically ezetimibe shows less effect on the myopathy and rhabdomyolysis at the dose used to control the cholesterol absorption. But when this drug is combined with other drugs such as statins, otherwise fibrates, these statins and fibrates can individually produce myopathy as well as rhabdomyolysis. So this combination will have more risk to produce myopathy in the patients. So creatine kinase levels may be elevated, and when they are elevated to 10 times, then this combination should be withdrawn so that ezetimibe can be used as a monotherapy. Otherwise, it can be replaced by statins in order to reduce muscle damage in the patients. Now let us see the chemical nature of this drug. So this is the structure of ezetimibe, and here we can observe a 4-membered heterocyclic system with 1 nitrogen. So let us give the numbering. We can start the numbering from the nitrogen. So this is 1, 2, 3 and 4. Now simply this is the azetidine with second position one, so azetidine 2-one. Now to this azetidine, at the first position 1 phenyl ring, fourth position another phenyl ring is present, and third position a propyl chain is present. So we can write these chains as 1-4-fluorophenyl. At the first position para-fluorophenyl group is present. Similarly, at the fourth position para-hydroxyphenyl group is present, which can be written as 4-4-hydroxyphenyl. Then at the third position it is having a propyl chain. Let us give the numbering to this chain 1, 2, 3. So this propyl chain is having the hydroxyl group at the third position. So we can write it as 3-3-hydroxypropyl. So to this propyl chain, again at the third position para-fluorophenyl group is present. So it is 3-4-fluorophenyl. That is the name of this ezetimibe. Now let us see the side effects of ezetimibe. The important side effects of this drug mainly include dizziness, some arthralgia, joint pain, diarrhea. It can produce some gastrointestinal side effects because the cholesterol is not absorbed. It is going to be excreted through the feces. So it can produce some gastrointestinal disturbance resulting in the diarrhea. And upper respiratory tract infections, so that it can produce some sinusitis, nasopharyngitis, and some fatigue can be observed because of reduced absorption of cholesterol. And myalgia, muscle pain can be observed, particularly when it is combined with other drugs such as statins, some back pain, and any anaphylactic reactions can be observed with this ezetimibe. How it is given? This drug is available as tablet and it is available at a strength of 10 mg. This drug is given as 10 mg once daily in order to reduce the cholesterol absorption. So it can be given either with or without food. But when this drug is combined with the bile acid binding resins, the gap should be maintained. This drug should be administered within 2 hours of bile acid binding resins, otherwise 4 hours of their administration, such that we can prevent the drug interaction between bile acid binding resins and ezetimibe. So that's about this drug ezetimibe, which is a cholesterol absorption inhibitor. This drug is specifically inhibiting the absorption of cholesterol so that it can reduce cholesterol absorption and storage into the liver. And when the stores of cholesterol within the liver are going to be reduced, it can increase the expression of LDL receptors so that more LDL cholesterol is going to be taken by the liver, resulting in the decreased LDL cholesterol as well as total cholesterol within the blood. This reduces the risk of atherosclerosis, and other cardiovascular complications. That's why ezetimibe can be used as a monotherapy. Otherwise, it can be combined with other drugs such as statins and fibrates so that it can reduce both LDL cholesterol as well as triglycerides within the blood. So this drug can produce gastrointestinal side effects such as diarrhea, and elevation of liver enzymes and myopathy are two important precautions that should be considered, particularly when this drug is combined with other drugs such as statins. This drug produces some dizziness, arthralgia, myalgia, and upper respiratory tract infections as important side effects, which can be easily controlled by the patients. So that's about this drug ezetimibe. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.